My name is Tanya Brunzel Winder. I'm a nurse practitioner. I have been a registered nurse for over 20 years and a nurse practitioner for the last 11 years. And I'm here to pitch for Life Cycles Health Center. This is a health center that I'm looking at opening up in Camden, New Jersey, in a public housing facility for the underserved population. What I am asking for is $330,000 for initial setup. Why? Obviously, to help the underserved population with their many healthcare disparities, as well. This will make us to be the first nurse managed health center within the city of Camden. Life Cycles Health Center, as being a nurse managed health center is a health center that is run by advanced practice nurses. So they are registered nurses that go back to school to obtain a training in advanced physical assessments to be able to diagnose and prescribe and to treat. And basically, in that case, we serve the underserved population that do not have necessarily access to health care. So, are there any other nurse managed health centers? There's actually over 250 within the country that serve the underserved population that may not have access to health care, or they may not just have insurance or enough insurance to provide them care. We are actually considered a critical access point for this population, as well as we provide an expanded service for these people that cannot reach the type of care that they need. So, to some of the statistics within the city of Camden, we have some heart disease, 346 out of about 100,000. We have a little bit over 3,500 new cases of diabetes, as well as increasing rate of obesity. But the key thing here is that we have over 79% of this population in Camden, New Jersey, that uses the emergency room, and to be exact, Cooper University Hospital for primary care. Why? Because they don't have access to this much needed care to just manage their primary care needs, chronic disease processes, or just basic preventive health. So, what will Life Cycles Health Center provide? We will provide health promotion. We will do preventive care, meaning immunizations for children. We will be there for just your basic blood pressure checks, your diabetes. If you need intervention or treatment, we will provide that. We will also be providing just general women's health, STD testing, the basic type of care. And we will be providing care through the life cycle from infancy to older age. And what will this nurse managed health center provide? We will actually be able to provide decrease emergency room use, which will actually be a tremendous offset to the taxpayers and Medicaid, because with people not having to go to the emergency room, but to be able to actually come to the health center within where they live, because the clinic that we're going to be opening up pretty soon is actually located in a 22 floor public housing unit that is actually directly across the street from another public housing unit surrounded by low income housing. And of course, the biggest thing too is decreasing morbidity and mortality among this population. Now, what can we do? Well, as nurse practitioners, when you look at sustainability, we can bill. We can bill Medicaid and Medicare as well as commercial insurances to be able to get reimbursement to keep this nurse managed health center open once we receive this donation. Another thing, once again, I mentioned we are safety net providers to the underserved, vulnerable population, as well as the key thing that's going on is a stated fact. The American Association of Medical Colleges has put out a report. As of 2025, we will have a physician shortage of 90,000 physicians in primary care. So, of course, who would be the greatest population affected by this? This will be the underserved, vulnerable population. Ooh, sorry. All right, so the operating budget for the first year to define where this 330 came from is basically categorized by a nurse practitioner, a medical assistant, a medical biller, of course, so that we can get the funding back in from the insurance companies as well as the medical receptionist, someone to manage the IT, because we need to have this on electronic medical records. Not to mention, this way it will allow to show that the diabetic patient that we see that might have those blood sugars in the 3 or 400s, or what we would say the hemoglobin A1C of maybe 9%, with this intervention at their doorstep, literally, we can then see that their sugars are down and that hemoglobin A1C is down to 6, because we are tracking that, as well as that patient that might have the high blood pressure. Okay. All right, so I just skipped the timeline, just projected visits of what we are looking at in regards to increasing over the year, like I said, because of where the location is in general. So the organizational structure is based around is myself. I am a nurse practitioner. I do have a physician that is on our board, as well as a VP of a financial company that is our treasurer, and a couple other nurses that are joining in my venture. Once again, what do we need? We need $330,000 for startup costs, and that is it. Thank you. I look forward to answering any questions in the reception.